The impact of abdominal or belly fat on health is significant and multifaceted. Excess belly fat, particularly visceral fat, the fat that surrounds internal organs, is associated with a range of health issues. Here are some key points on how belly fat can affect health. 1. Cardiovascular disease. Increased risk. Excess belly fat is strongly linked to an increased risk of cardiovascular diseases, including heart attack, stroke, and high blood pressure. Mechanism. Visceral fat releases inflammatory markers and fatty acids into the bloodstream, which can lead to the buildup of plaque in the arteries, a condition known as atherosclerosis. 2. Type 2 diabetes. Insulin resistance. Belly fat is closely associated with insulin resistance, a condition where the body's cells do not respond properly to insulin, leading to elevated blood glucose levels. Risk factor. This makes excess abdominal fat a significant risk factor for developing type 2 diabetes. 3. Metabolic syndrome. Cluster of conditions. Metabolic syndrome is a cluster of conditions including increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Increased risk. Having metabolic syndrome increases the risk of heart disease, stroke, and type 2 diabetes. Cancer. Excess belly fat has been linked to an increased risk of several types of cancer, including colorectal, breast, postmenopausal, pancreatic, and endometrial cancers. Chronic inflammation caused by visceral fat can contribute to the development and progression of cancer. Liver disease. Excess fat can accumulate in the liver, leading to non-alcoholic fatty liver disease or NAFLD. This can progress to liver inflammation, known as non-alcoholic steatohepatitis, fibrosis, and even cirrhosis. This affects the liver's ability to function properly and can lead to severe health issues. Respiratory issues. Excess abdominal fat can restrict the diaphragm, leading to breathing difficulties and reduced lung capacity. There is also a higher risk of obstructive sleep apnea, a condition where breathing repeatedly stops and starts during sleep. Joint problems. Excess weight, including belly fat, puts additional stress on the joints, particularly the knees and hips. This can lead to or exacerbate osteoarthritis and other joint-related issues. Inflammation. Visceral fat is metabolically active and releases cytokines, which promote chronic inflammation throughout the body. Chronic inflammation is a key factor in many chronic diseases, including heart disease, diabetes, and certain cancers. Hormonal imbalance. Belly fat acts as an endocrine organ, secreting hormones that can disrupt the body's normal hormonal balance. This can affect various bodily functions, including metabolism, appetite regulation, and reproductive health. Strategies for reducing belly fat. Focus on a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Reduce the intake of processed foods, sugary drinks, and unhealthy fats. Incorporate both aerobic exercises like walking, running, and swimming, and strength training into your routine to burn calories and build muscle. Chronic stress can lead to weight gain around the abdomen. Practices like mindfulness, meditation, and yoga can help manage stress levels. Aim for 7 to 9 hours of quality sleep per night. Poor sleep can affect metabolism and increase the risk of weight gain. Excessive alcohol consumption is linked to increased belly fat. Moderation is key. Conclusion. Excess belly fat, particularly visceral fat, poses significant health risks. Adopting a healthy lifestyle that includes a balanced diet, regular exercise, stress management, and adequate sleep can help reduce belly fat and improve overall health.